Hey, so you've had an anatomy scan and it's showing fetal renal dilatation, and now you're feeling a little bit freaked out about that, eh? Yeah, so renal dilatation of the fetal pelvis or pelvises of their kidneys is super common, actually, for that to be seen at an anatomy scan. It's not uncommon at all. And when it's mild dilatation, not a lot of big concerns that we have over there. It is different if there is, more intense, severe dilatation going on, particularly if it's accompanied with some other soft markers. But on its own, as an isolated thing, don't be stressing about it. But I'll tell you more about it as well. So when you have an anatomy scan, there are basically what they call hard markers and soft markers that they're looking for. So they, bearing in mind you're still dealing with really quite a little baby at this stage. It's really quite small still. And so the anatomy scan is pretty basic. It's really looking at does the baby have two kidneys? Does it have four chambers in the heart? Do the limbs look like they are forming normally, etc., etc. Or, does the shape of the brain inside look normal? But we do see, so sometimes the sonographers will see something called a hard marker, and that is when there is a very specific anatomical abnormality. So they may be able to diagnose straight away and say, look, this baby has one limb, one arm that's not forming properly, or this baby looks like it has a cardiac issue, or, there'll be hard markers. And when they see a bunch of different things, then that can sometimes be an indication that the baby may have a chromosomal disorder, which obviously they can't diagnose that by an ultrasound image. But, when they see a bunch of different things that are all sort of anomalies associated with a particular syndrome, then that's obviously a red flag going, maybe these parents want to do some genetic testing on this baby, such as it would need to be an amniocentesis, really. But when you see, often they will see things that are soft markers, which are just on their own, really don't mean a lot, but they can't report the ultrasound scan as being normal because they've seen this thing that's a little unusual or not quite normal. So as I say, it's just a soft marker. It doesn't mean a lot, but there's a process of what goes on when we do see that. So the first thing is that when you will see a mild level of detected anatomically at the anatomy scan of fetal renal pelvic dilatation. When they see that, they'll say, okay, let's get you back in the third trimester, usually around about 32 weeks or thereabouts, to do another scan. So at that point, one of two things happens. Either they check and it's gone, it's disappeared. That happens a lot of the time. Or they'll say, it's still present and it's still mild. Okay. So if it's disappeared, then that's it. There's nothing further done. If it's seen again at around 32 weeks and it's quite mild, which it usually is, then traditionally what would happen is that after the baby is born, around about, and somewhere in that first few days or by day 7 or something, they would then have another ultrasound scan, because it's obviously easier to more thoroughly scan the baby when they're out of your womb than when they're inside your body. They're going to get a clearer vision of what's going on. However, there has been more trends in recent times, looking at more sort of research that's come along, that really that first scan after they've been born is done more like at 1 or 2 or 3 months old instead, because oftentimes by then it's just naturally disappeared. So doing it at 7 days kind of, or in that first 7 days, sort of triggers all these like other complications of things that don't need to be complicated on, really. So if we just wait to 1 or 2 or 3 months old, after the baby's born, then have it done. It's usually well and truly disappeared. Okay, however, if the mild dilatation of the renal pelvis is still visible, when the baby is sort of 1 or 2 or 3 months old, then generally the next process is that they have another scan done at about 12 months old. And so long as at 12 months old they have been asymptomatic, like there's no problems going on, there's no health concerns with this baby, then they just go, oh well, let's leave it, don't worry about it. Like there's nothing to do. There have been times in the past, and some obstetricians are still doing it, where they may do things like give the baby prophylactic antibiotics, but why? I mean, there's no infection going on. If there was infection, well, then that would be appropriate. But if there's no infection, why would you do that? Because the purpose of antibiotics is to kill bacteria. So if there's no bacteria there, why would you do that? And certainly these kind of handing out prophylactic antibiotics like candy has been, well and truly frowned upon, in recent sort of years and recent decades, because what we're doing is we're creating, antibiotic resistant bacteria that, we don't want to be doing that. And if we really want to be killing all the good bacteria that's naturally within that baby's gut microbiome, it's anyway. So not really appropriate probably to be doing that. Now, in rare cases where there is more severe renal dilatation, that can be associated with a chromosomal anomaly and perhaps other, as I say, anatomical abnormalities as well. But that naturally tends to declare itself. Like there's other stuff going on, and at that point, you'd be seeing a pediatric urologists, and there'll be other senior people involved. But the main thing I guess I would say is don't stress about it. Look, that's the problem with ultrasound scans, is that they sometimes they show us stuff that really doesn't mean a lot, but all it does is create worry. And if there's one thing that we absolutely know is bad for pregnancies, like bad for pregnancies, is stress, is maternal stress. So definitely, don't be overthinking this. Please don't be overthinking it. It's mild renal dilatation seen on an anatomy scan is not uncommon. It's not anything to get really stressed about, because anxiety and stress and worry will do more harm to that pregnancy than you not knowing about the fact that there was some renal dilatation. Anyway, look, love you and leave you, and hope that that's a lot of reassurance, and that you can feel like you do have some peace of mind, because I know we all worry, but that's not one you want to be worrying about. Okay, all right, bye everybody.